Hi, my name is Emmanuel MONNERON and I'm a French psychiatrist. I've been working for 3 years in a public hospital here in France, and I wanted to talk about the troubled teen industry. So this is going to be the first video of a series of videos about this industry. If you don't know what the troubled teen industry is, you can follow the links under this video to find some useful information. This first video is going to be about prescription and medical treatments. I'm sorry, I'm going to read some notes because doing this in English is kind of challenging for me, and I wanted to do this in English to make sure everyone would be able to understand. So I've read a lot of testimonies written by people who were sent to these facilities by their parents, and it seems like a lot of teenagers and children there were forced to take medication such as antipsychotics, antidepressants, Ritalin, and also other treatments. So first thing I want to say is that forced medication is never appropriate. Talking with a child or a teenager about why a prescription seems necessary is an important part of the therapeutic process, and I think prescribing some treatments without the child consent is probably dangerous, and it's not going to help a patient. I also want to say that these treatments should only be prescribed after some clinical exams and blood tests and sometimes an electrocardiogram. And the problem is there usually isn't a medical professional in the troubled teen industry facilities because of financial reasons. I've read a lot of testimonies saying that a lot of prescriptions were only some standardized forms filled by a psychiatrist who was there only every 3 months or every 6 months. Of course, this is absolutely not enough to be able to assess the benefits of the treatments, to monitor the side effects, and to be able to review the prescriptions if necessary. I want to remind everyone that a very important principle in medicine is first you make sure that you're not going to make the situation worse. So because of these important side effects, not being able to perform some medical exams at least twice a week can be quite dangerous when you prescribe that kind of treatments to children or to teenagers. I also read that some children were told that the prescriptions wouldn't be reviewed before they would reach a certain level in the education program. I think this is absolutely unacceptable. A treatment should never be used as a punishment. It should never be used to force a child to obey some rules, and it should only be prescribed based on medical and clinical criteria. So using a treatment to force a child to obey some rules is completely unethical, and I really think that the licensed doctors who participate in that kind of activities should face some sanctions. So for all these reasons, I think facilities hosting children and teenagers full-time, especially medicated children and teenagers, should be checked frequently by child protective services. Victims of these places need attention, and that's the reason why I am supporting Breaking Code Silence movement. If you don't know the movement, you can check the links under this video, and you can also sign the petition to shut down the Provo Canyon School. I thank you for watching this video. There will be more soon, and make sure that you share this video and that you talk about the troubled teen industry around you. Thank you.